You know, Antonio, the most exciting thing I'm finding is that this has, your father, he has blended Western and Eastern medicine. And he's taken this information, he's known about this, but information is coming out now that the whole acupuncture system is associated with the connective tissue system. And he has found these specific points in the connective tissue system, which happens to be acupuncture points that seem to have a much greater effect on healing than just any particular point in the body. And the best thing about it is that these points can be found by way of a functional examination.
Really appreciating the Stecco fascial manipulation work. It's another wonderful soft tissue piece. At first I was skeptical. What, another soft tissue thing? I got Graston, I got hands-on, I got all my fat, all this visceral that I do. But what I found is I'm getting to places I never got before. I'm working points I never experienced before. I had one patient, a 21-year-old, who felt like her life was over. She was in such severe pain and hardly able to do anything. I did 8 weeks of my usual creative stuff, not just adjusting her, but lots of soft tissue and lots of work and up and down, looking at all kinds of things, and it still didn't change her. She came in just after I got back from this class. I started working the points around her diaphragm and the points in her chest, and boom, within 2 weeks her pain levels were down to about a 2 or 3 from an 8, and she had a life again. It was wonderful.
Fascial manipulation has changed my practice in that it has given me a more global view of the human body. I'm looking at it in a more three-dimensional way. In looking at the fascia as a network that is ubiquitous throughout the entire musculoskeletal system, the ability of it to guide all of our movements, and the possibility of it halting movements or causing aberration in movement as a result of the densifications in the fascia gives me a new way of looking at this and a new way of treating.
So the best position for treat is this one, okay? Biceps, short tendon of the bicep, and here deeper, so under.
I really think the fascial manipulation method is onto something that is fresh and new. It's a blending of a lot of different types of therapy and ways of looking at very common pain syndromes that many of us see in physical medicine. On the one hand, we've got research that indicates that we're looking at that what we're working on is very similar to meridian planes from acupuncture. It also correlates well with the myofascial trigger point research, and it also contributes well to some of the other neuromobilization type of research from the likes of David Butler and Michael Shacklock.
This course because I thought it would be a nice way for me to integrate the chiropractic and acupuncture. I'm a licensed chiropractor and a licensed acupuncturist, and the course has a lot of things that relate with acupuncture and the meridians. And so since the course, the first part 1A, I've changed some of the needling techniques so I can affect fascia more versus muscle, and it has that nice red response and a heat response. So now I'm doing a blend and integrating some acupuncture points while I then also treat some of the points, which allows me to treat more points in one visit than I would had I not had the acupuncture course.
I took this course because it was recommended to me by Twee Katzenberger, who you just spoke to, and we co-treat a lot of the same people. I work in a health and fitness environment, so for me I see a lot of athletes with injuries and specific concerns, and they typically want that quick fix. They're not in for the relaxation style massage, they want specific points worked on, and I think this has enabled me to kind of cut that time down to figure it out really quickly and go to those points and treat them and get good results in a short period of time so they can get back to their regular activities.
Fascial manipulation as a massage therapist has given me the opportunity to create a plan for my patients and also discuss the plan with my fellow colleagues, which has helped clarify our treatments, and also it speeds up the treatment for us.
The fascial manipulation course has been incredible. I love the research component that they've brought in to validate the work that we're doing, which is so refreshing. I can go in and talk to, I deal a lot with some orthopedic docs, some physical therapists, and to come in and have that solid foundation will definitely add validity to my practice. Already have had great results. One patient who's been struggling with lateral epicondylitis cleared it up with one treatment. He was surprised, I was surprised. It's been 2 months now and just got an email from him that everything's going great. So it's really good stuff. I've already told a number of my colleagues that it's definitely worthwhile to come in and get this great education.